a lot of us went to medical school because we were interested in service, but that can get lost over the course of medical school. And I think going into primary care, you sort of keep a little bit of that alive.
I truly think primary care saved my life, my career life, because this is why I went into medical school, and I don't think I would have found it anywhere. And I may have been top cardiologist, maybe, but I would not have found it there or anywhere else to be able to look after patients so comprehensively, and not only that, but to really care for them.
My husband and children and I were walking to pizza in our town, Newton Center, and there's a busy intersection there, and as we were heading around, a car pulls up, and these 3 doors open. It's sort of like a circus car, and in the back seat I see Mrs. M, I'll call her, about 84 years old. She's got, osteoporosis, osteoarthritis. She can't quite get out of the car, but she says something to the other 2 who run over and give me a big hug and say, thanks for taking care of Mom. And as fast as they zoomed up, they zoomed away. And my little guy, Danny, who's was about 7, this was not this summer, but the summer before, and he said, geez, Mom, that was really cool. And my daughter said, who was like 10 at the time, said, that old lady must really like you, because that was pretty dangerous. She could have gotten hurt doing that. And then I was thinking, that was sort of a moment where, as a primary care doc, I sort of felt like a rock star, or like a professional athlete like Shaquille O'Neal walking around town. And the funny thing is, now when I go through that area with my family, I'm always sort of, looking around, waiting for someone to pull up fast and come give me a hug, just for being their primary care docs.
Well, I think the beauty about Valerie Stone is that she has an incredible professional manner, but she's very human and she's very real and authentic. But I needed her to get tough, and I wasn't willing to take that first step, and so she did. And basically said, you keep talking about it, Anne, and now we need a plan. We need a plan. And then, so what are we going to do? How can I help you to achieve this goal?
We like to have favorite patients, but I do have one. She's a 74-year-old smoker already, had lung disease, on oxygen, developed atrial fibrillation, diabetes, heart disease. So she was completely immobile, basically, on oxygen, not looking like she was going to live very long. And she started gradually walking every day, and I would see her, because she lived at the Blackstone, so I'd see her when I was walking to work, and she'd be walking all the time to Cafe Padima down the street. And over time, we got her from basically not being mobile, not being active, not doing anything, always in the hospital for various flare-ups of her chronic diseases, to somebody who was out every day, rain or shine, ice storm, at Cafe Padima, at Whole Foods, just walking back and forth. And her health was so much better. I used to call her, or have my nurse call her in the morning and check her weight, because she was prone to getting CHF exacerbations. She did not want any of this monitoring in her house. She was like, I'm not into that. It was the contact. It was the relationship that got her better, I think.
I actually used to teach patient-doctor with Dr. Stoeckle. So I have known him. He is a primary care doctor and internist, so his patients are clearly a different population than mine. But it was so enjoyable teaching that course. We were teaching the first-year medical students about, talking to patients. And his patients, he would have been seeing them from my point forever. This was already 15 years ago now. And he would know, the grandmother and the daughter and the grandson and all that.
Well, I think when you see people over the years, you learn so many bits and pieces about them in terms not only of the diseases they have and the disabilities they have, but you know how they cope with them and who else in the family tried to help them. All the sort of, if you will, stories around what they've got. I think that's part of doctoring, basically, that you have to not only deal with the disease the patient has, but with the illness.
If you're going into primary care, you're not going to primary care because you're like, wow, this is going to be a luxurious specialty. This is going to be an easy road. You're going there because you're like, I want to make a difference, and I know that primary care is the place to make the biggest impact.